All right, you've gone quiet and I think I'm ready. So let's kick off, ready to rumble, as I just heard Renzo say. So welcome. I'd like to begin by acknowledging country and pay my respects to elders past, present and emerging. We're all seated on the lands of the Wurundjeri people of the Kulin Nation. Terrific grand challenge session today, and I am Brett Sutton, Director of Health and Biosecurity at CSIRO. I'm a co-chair for this session, and I'm co-chairing with Professor John Thwaites on the end here. He's a Professorial Fellow of Monash University, Chair of the Monash Sustainable Development Institute and Climate Works Centre. We've also got Professor Catherine Bowen, Deputy Director, Melbourne Climate Futures at University of Melbourne, Associate Professor Renzo Ginto, Associate Professor Singh Health Duke, NUS Global Health Institute, National University of Singapore, Visiting Professor of Global and Planetary Health, St Luke's Medical Centre, College of Medicine, Philippines. Luckily, you're only being introduced once, Renzo. Professor Jonathan Patz, Distinguished Professor, University of Wisconsin-Madison, USA, Adjunct Professor at Monash Uni. Professor Ollie J, Director, Heat and Health Research Incubator, no pun intended, and Thermal Ergonomics Laboratory, University of Sydney. And Mere Nawula Matua, Consultant Urban Planner, Pacific, Fiji. So, grand challenge is the right terminology, I think, when we think about climate and health. And today's topic, from climate change evidence to action, accelerating pathways for healthy people and a healthy planet, it's worth reflecting on just how urgent and profound that challenge is. It's a gargantuan problem, and it's gargantuan because we've known about it for decades. We've been increasingly motivated to do things, but through all of that time, our global action has been insufficient to manage the profundity of the risk to human health at a planetary level, at a population level. It has been described as the greatest threat to health in the world, and I think that's true. One of the challenges of climate change as a threat is that it is invisible in many respects, and it has a long latency period. But that long latency period is already coming to play out for us, as we see the world today already affected by global warming and the volatility of weather systems, and the increasing challenges to human health and security and well-being that are a consequence of that volatility. It is also a huge opportunity. There are profound co-benefits that you'll also hear about today, and there are opportunities for us to address some of those other intersecting problems of biodiversity and the threats to the biosphere. We nonetheless need to reflect on this topic from evidence to action. If we are researching and we come to a research output and it goes no further, we have failed. If we come to innovations and technologies that are brilliant, but that are not scaled to population to shift the dial at a profound level for populations, we have failed. If we come to insights that are deeply relevant to policymakers locally, regionally and globally, but that we do not translate those insights into policy decisions that can protect our precious earth and its people, then we have failed. But I am optimistic. We know what the issues are, and we know in many, many respects what the solutions are, but we want to move from evidence to action. We've got a fantastic lineup of speakers, and so I will begin with our first question for speaker one, Catherine Bowen. Catherine, can you outline your views on the role and value of the IPCC in framing and leading resilient, sustainable and equitable development for health in the context of climate change? Just a little question for you. Thank you.
Thank you, Brett. And I assume my slides are coming any minute. Thank you very much. Thank you for the invitation to speak today, and I'm delighted to see climate and health having such a strong profile at this meeting. I've actually found today quite a heavy day, and so I've just been listening to the Health and Human Rights session that was on before this. And so, a lot of deep discussions and reflections about the state of the world we're in at the moment. So what I will do is I'll provide you with the framing that I think the IPCC presents so that we can move towards solutions. So I'll outline some of the high-level statements from the IPCC, but then also really focus on, well, what are we doing? So I was, as you know, Brett just asked me to speak about the IPCC and framing. And for those of you who aren't familiar with the IPCC, it's the Intergovernmental Panel on Climate Change, and it's the assessment of the evidence base, so what we know about climate change. And in this case today, climate change and human health. In the 6th assessment report that was recently finalised, we are actually up, or at the beginning stages of the 7th assessment report. It's just kicking off now. But in the 6th assessment report, so AR6, we've seen the literature exponentially increase so that our confidence levels on many different health and climate topics are now much stronger. So from the AR6 though, 3 frames have clearly emerged, and I'll briefly speak to each of those frames. The first is urgency, transformation and equity. Oh, that's it, great. So perhaps this statement best summarises our findings from the AR6. The scientific evidence is unequivocal. Climate change is a threat to human well-being and the health of the planet. Any further delay in concerted global action will miss the brief and rapidly closing window to secure a livable future. This framing is about urgency. It's different to the assessment reports that preceded it. It really is about saying that action is absolutely critical right now. So moving on to the health impacts of climate change, I'll just present to you the high-level headline statements is what we call them. And then I'll move to the second framing, transformation. So with very high confidence, we were able to state in the 6th assessment report, in the human health chapter, that we're seeing an increase in climate-related illnesses, premature deaths, malnutrition, and threats to mental health and well-being. A second high-level statement is that with proactive, timely and effective adaptation, and I need to clarify that Working Group 2, the working group I'm part of, was focused on vulnerabilities, impacts and adaptation. Working Group 1 is focusing on the climate science, and Working Group 3 focuses on mitigation. So with proactive, timely and effective adaptation, many risks to human health and well-being can be reduced and some potentially avoided. Very high confidence, that statement. The third high-level statement is that key transformations, so this is the second framing perspective that the IPCC talks about, is these key transformations that are needed to facilitate climate-resilient development pathways for health and well-being. And I'll talk a little bit more about climate-resilient development. And then the fourth headline statement for health is that transformational changes will be more effective if they're responsive to regional, local and Indigenous knowledges and consider the many dimensions of vulnerability, including those that are gender and age specific. Don't have time today to unpack the concept of vulnerability. Notwithstanding it's a controversial topic, there is a global shift away from using that terminology to concepts like at-risk communities or geographies rather than vulnerable, but that's a conversation perhaps to pick up later. So that framing was around transformational change. The third framing lens that the IPCC really brought to the fore this round was on equity and justice. So again, repeating the statement from the AR5, the fifth assessment, and the fourth assessment. Health impacts are often interconnected, unevenly distributed across and within societies, and will continue to be experienced inequitably. At its core, climate change is an issue of equity and justice. So you can see in this image as well, this is from the sixth assessment report, all countries are exposed to climate change and climate-related risks to health and well-being, but at-risk populations are not evenly distributed across regions, nor within countries, as we heard about starkly today. We've estimated that between 3.3 to 3.6 billion people live in global hotspots of high vulnerability or high risk to climate change. And these are also in our region, in the Indo-Pacific region. So again, this issue of equity and justice. Those least responsible for the climate change that we are seeing and we are continuing to see are going to feel the brunt of the health impacts. And in these global hotspots I just mentioned, there are many overlapping challenges, including limited access to water, sanitation and health services. So at the basic building blocks of our health system, we are still not meeting these in many parts of the world. High levels of climate-sensitive livelihoods, such as smallholder farmers and fishing communities, all increase risk as well. High levels of poverty still, weak leadership, lack of funding, lack of accountability, and a theme we've heard quite a lot through this summit, trust in government. They also play a part. So this leads me to the concept that the AR6 presented around climate resilient development. So given all of this in the background, how are we going to move to solutions? So this is the solutions framework that has been presented, involving traditionally marginalised groups, including women and young people and Indigenous peoples, local communities and ethnic minorities, improves the prospects for effective action. It's critical to prioritise equity and justice in decision-making and investment, particularly. So different interests and values and worldviews can be reconciled if everyone works together. The fundamental difference with this climate resilient development framework is that it's bringing in adaptation and mitigation and sustainable development. So historically, we've tended to silo those issues and people have worked in one or the other. But climate resilient development is encouraging the holistic, the integrated understanding to grapple those changes, or those challenges that are presented to us. No longer can we continue to work in those silos. There's a long way to go, though. So this is an example of how the health sector might operationalise climate resilient development. It's imperative that we look towards low or no regret measures that provide immediate health benefits, reduce the risks from current and future climate change, and support the SDGs. So 3 ways we can do this. We can enhance the climate resilience of health systems, and what you can see up there, I'm sure many of you are familiar with the 6 building blocks of the health system. Also overlaid on that is looking at these building blocks through a climate lens. So how, for example, do we support our health workforce in the context of knowing that these extreme weather events will continue to impact on communities that are at high risk? How do we make sure that communities are able to build their resilience and respond? We know that these extreme weather events are happening in a compounding manner as well. They're cascading on one another. No longer do we have the time or the resources, as different communities know, to build back before there's another extreme weather event. And we've got many examples of these in the last 12 months in Australia. Efforts related to broader development action. So as I mentioned earlier, we still do not have adequate, sufficient access to basic water and sanitation and hygiene services in many, many parts of the world. I work predominantly in the Indo-Pacific, and this is something that we are trying to linked together in terms of our climate change actions is, well, how are we going to see water security be increasingly impacted by changes in the climate? So how do we address our basic services around WASH, for example? And then the third is around efforts related to early warning systems, monitoring, and of course building the evidence base or the knowledge base in partnership. So the concept of co-design is vital for any of these sorts of solutions. And as a brief example, going into a bit more detail, many countries are now developing their Health National Adaptation Plans, or their HNAPs. So this helps to set the direction for climate solutions for the health sector. And these are vital pieces of both policy and process. Without these HNAPs, we're unable to develop the solutions that are urgently required to address the health impacts of climate change. Our voices as the health sector are now being heard at the national level. And a lot of the work I do is supporting countries to develop their HNAPs. Because once an HNAP is developed, it then feeds into the National Adaptation Plan, so health becomes part of the discussion. We can't be doing our own thing all the time. We need to integrate our work into the national climate change solutions. And then they're fed into the UNFCCC's processes, the UN Framework Convention on Climate Change. So we are now being heard at the national and at the international level. So I'm showing you this image from the sixth assessment report as the IPCC, for the first time, included humans in its figures as a way of showing the different impacts that climate change will have on different generations. So those born in 2020, so in the middle there, for example, will face a much different future compared to those born in 1980, as you can see in the darker red shades. So the darker the red, the greater the temperature increase over time. This image talks to the choices we make now and how these will clearly determine the shades of red that future generations will experience. A child born now is likely to suffer, on average, 3 to 4 times as many climate extreme events in their lifetime as their grandparents did. So this is the urgency framing again from the IPCC. So that's all been a bit dire. My final slide, I'll finish with a thought from Tom Rivett-Carnac, who was the chief architect of the UN Framework Convention on Climate Change, and the author-illustrator Oliver Jeffers. If you can't read that, it says, all of the problems, also all of the solutions. If we root our despair in climate change, then we must root our hopes in its solutions. It's time to intentionally put our efforts into creating and sharing stories of what is possible. Stories that bring out the most extraordinary aspects of humanity. Compassion, kindness, ingenuity, and creativity. These are the stories we can choose to tell, and we must choose to tell them together. Thank you.
Thank you very much, Catherine.
Yep, that's all. We've now got the opportunity to hear from our second speaker, Associate Professor Renzo Ginto from the National University of Singapore. And Renzo, we've heard the perspectives from Catherine from the IPCC and the global perspective, but could you tell us a little bit about how local action can help embed resilient planetary health systems?
Thank you very much. I guess to answer that question, I'll be using a case study that I'm most familiar with, and that's the case study of my home country, the Philippines. And I hope that this case study will reinforce many of the messages that Catherine has shared with us. I also just want to emphasize that I use in the title "glocal," Because yes, this global challenge of the climate crisis requires a global response, and we've heard some of the intergovernmental processes that are happening as we speak, or maybe have been happening for so long, and therefore action keeps on getting delayed and delayed. But it also requires local action. So local action for planetary health is what we need. And I mentioned planetary health. I want to begin by framing my remarks using this new concept, or maybe not so new concept of planetary health. We are in the World Health Summit. And oftentimes when we talk about the health of the world, we tend to ignore the health of the planet. We know that the health of people and the planet are deeply intertwined, if not inseparable. I always remind my medical students back at home in the Philippines, but also now in Singapore, that we now have to treat two kinds of patients, not just the people, but also the planet. And that is what planetary health is about. We know that climate change is one of the major planetary health challenges that we're facing today. I will not belabor you with the details of this diagram from a Lancet report. There are multiple arrows, many boxes. It just tells us that climate change affects human health in many different ways. And as you can see on your right, that there is really no single disease group that is going to be immune to the climate crisis. So I always tell the clinicians, regardless of your specialty, you have a critical role to play to address climate change. And Catherine already highlighted the inequity, the injustice that is embedded deeply at the heart of the climate crisis. This is from a paper that I co-wrote, and we basically visualized how, inequitable the distribution of health impacts is. Here you will see the map of the world where, the redder the country is, the higher the contribution of that country, that region, to the generation of this planetary crisis, in particular through carbon emissions. And in this set of maps, you will see that the victims, the countries, and the populations that are going to bear the brunt, that will suffer the consequences of climate change and its health impacts, are not the same as the previous map has shown. Africa, huge swaths of Asia, and of course the Pacific being at the heart of the climate emergency. And in this map, I'm also bringing you to my part of the world, Southeast Asia. In this map, the redder the country is, the higher the vulnerability of the country is to the climate crisis. And unfortunately, my home country is the reddest of them all. And so in the Philippines, we're really starting to get serious about addressing climate change, preparing for the impacts on health in many different arenas. And in the next several slides, I'll just show to you what are the effects that we're already facing. I'm sure you've been seeing in the news each year, all the time, the Philippines is hit again with another typhoon, a cyclone coming from the Western Pacific. And over the past several years, we've been seeing and observing that these typhoons are increasing both in number and in severity, which cause large flooding and landslides, and ultimately affecting infrastructure and the health and well-being of people. And over the past 4 years, we have seen the confluence between two crises. Imagine you're a country, on one hand, trying to contain a pandemic, coronavirus, and on the other hand, trying to also address the immediate impacts of climate change, of climate-related disasters. So it just shows to us that there are multiple crises happening at the same time, overlapping and interacting with one another, and we cannot anymore do a siloed, hazard-specific approach. We need integrated approaches to address these multiple and interlocking challenges. And as I already alluded to, we're more familiar with the wet phenomena related to climate, but especially in recent years, we are also experiencing now the hot and dry phenomena related to the climate crisis. Just for the past 2 weeks, close to 6,000 schools have been closed in the Philippines, affecting more than 4 million school children. They have to be shifted to remote learning because the heat is already unbearable. Our cities are becoming like ovens. And this is not unique to the Philippines. It's going to be happening also across the Asia Pacific. But I'd leave the heat discussion to my colleague Oli J, who will talk more about heat in a short while. And it's also important to recognize and remember that climate change affects not just our physical health, but also the health of our brains and our hearts. And this is something we're beginning to investigate in the Philippines, the nexus of climate change and mental health. I'm sure you've heard of the concept or the phrase climate anxiety. There's actually a 10-country cross-sectional survey that was published in 2021, and it showed that out of the 10 countries, including Australia, the Filipino young people are deemed to be the most climate anxious in the world because they're already experiencing climate change and its effects. They're worried about their future, whether they'll have a job in the next 10, 20 years. They are also afraid now to even procreate. And so that is a situation being faced by the Philippines in the Philippines, and it's also a situation faced by many low and middle income countries around the world. And you hear these scary and alarming news. The UN climate chief saying we only have 2 years to save the planet. Scientists saying we don't have until 2030, which is the deadline of the Paris Agreement. We only have until 2027 to stabilize the global climate system. And so the question that we should be answering now is, are we ready to build health systems that consider the climate? And in fact, I'll even expand this to reframing or rephrasing the question, are we ready to build systems for health that consider the climate? So it's not only our healthcare systems that need to be, Catherine was mentioning climate resilient, climate smart, all these new terms that have emerged over the past several years. It's really all the systems. This morning we have discussions around the social and environmental determinants of health. All of these sectors need to be climate resilient, climate proof, climate adaptive. I just want to share with you this slide, capturing all these new concepts that have been emerging. One concept is called climate smart healthcare. We need healthcare that is not only sustainable, green, low carbon, not harming the planet in the same way that we made a commitment, a Hippocratic oath to do no harm on our patients and our people. But we also need to build health systems and systems for health that are resilient, adaptive, like the bamboo, which you can find a lot in Asia. They bend without breaking. We want healthcare systems that do not collapse, but instead recover better than before, and even transform. And in the Philippines, some of the efforts that we're doing, Catherine, you mentioned the HNAP, and in the Philippines, in the recent COP28 in Dubai, we just launched our new national adaptation plan with a very significant section on health, which I helped develop. And it just shows that the health sector needs to fix its own backyard to make sure it's ready for the climate impacts while also not harming the planet, but also it needs to work with the other sectors, as you can see in this slide. We've made global commitments, and as I mentioned in COP28, the Philippines is the 80th country to join the Alliance for Transformative Action on Climate and Health, which is a new WHO initiative of ministries of health that made a commitment to establish or build climate resilient and low carbon health systems. But we are also doing some national efforts, solarizing hospitals, developing a green and safe health facilities manual. Of course, these are just the baby steps, the important foundations. We need investment, we need to implement, and we need to measure the impact to make sure that they benefit communities and people in the front lines. There's also a growing move now around being more familiar with climate data. We went to med school, we'd never learned how to interpret weather, climate data. Now we're being forced to be more familiar with these new data sets so that we can do better in terms of health planning. This is a map of my hometown, and what I found out was many of our health facilities in my very hometown will be inundated if climate change is going to worsen. And also, I mentioned a while ago the concept of planetary health. It's very important to build not just a village, but an entire nation of colleagues from different disciplines and sectors and even generations committed to improving the health of people and the planet. Visit planetaryhealth.ph, and you will find out more about the many things that we're doing, including in the area of education. We need to educate the next generation. We need to re-educate the current generation in order to be prepared, to prepare the workforce for a warming planet. And over the past 2 days, we've been talking a lot about health professionals, development, retraining. We need climate and health, planetary health, to be in the curriculum. We need to rethink human resources for health planning with a climate lens. I'm reaching the end of my presentation. I already mentioned we need to work with the other sectors. And in the Philippines, we already started also engaging the private sector in this new area of climate and health. But I want to give a word of caution. It has to be meaningful engagement, but not health washing. I invite you to read a commentary that we published recently, sharing our observations of health washing, even in the recently concluded climate negotiations. Companies that are using health messaging, seemingly pro-health activities without changing the DNA of their businesses, of their enterprise. And most importantly, in our pursuit to build resilient systems for health, for planetary health, we cannot forget the community. We always tend to say we want the community voices, we want to include the community, and they're not in the room. And so in our work, we try to co-diagnose, co-design, co-develop solutions for climate and health with communities that are already affected by the climate crisis in the climate front lines. I just want to end by highlighting that there will be no planetary health without climate justice. We cannot just keep on asking the communities in the front lines to adapt, to be resilient, and we're not fixing the root cause of this problem. And we are perpetuating, the climate crisis, the emissions, and the instability of our Earth's systems. And in order to build resilient planetary systems for health, we need to go beyond our usual discussions about interventions and, frameworks and mechanisms. We need to reimagine and rethink a resilient economic system that ensures the health and well-being of people and making sure we do it within the planet's boundaries. So thank you very much, and let's advance the health of both people and the planet.
Well, thank you very much, Renzo. And now we get to hear from Jonathan Patz, who's the John P. Holton Chair of Health and the Environment at the University of Wisconsin-Madison in the USA. Jonathan, what are the health co-benefits that we can achieve through climate action? And how can this framing help with advocacy for climate action?
John, thank you for that great question. And I also want to thank the organizers for holding this event on April 23rd in Australia, because it's still April 22nd, Earth Day in the United States, and my former governor, Gaylord Nelson, began Earth Day in 1970. So thank you for the organizer. So I'm going to be talking about getting to fossil-free, saving millions of lives in the process. And I have been working on climate change for actually 30 years. And the first 20 years, I worked on the risk assessment and why the climate crisis is a health emergency. And Catherine and Renzo, thank you for laying that out so beautifully. So I'm going to be talking about the last 10 years of my career, which is focusing on the opportunities of climate action, and that solving the climate crisis could be the greatest opportunity for health of our lifetime. A low-carbon future, improving global health, and achieving economic benefits. Climate solutions double as health interventions. So when we look at the root cause of climate change, burning fossil fuels, not only does that cause greenhouse gas emissions that are heating the planet, but of course we know that causes air pollution. And the latest findings are that air pollution kills it leads to 8 million premature deaths every year, of which more than 5 million of those deaths are directly tied to burning fossil fuels. Also, our food sector, as both the previous speakers mentioned, the food sector, especially in high-income countries where we have energy and resource-intensive diets, especially around red meat, that is unhealthy, it's not sustainable, and if the world were to adopt a universal healthy reference diet, mostly plant-forward, less red meat, that would avoid 11 million premature deaths every year. And finally, the transportation sector, because we have over-reliance on the private motorized vehicle, we are having more of a sedentary lifestyle. And active travel from biking and walking avoids about 3.9 million premature deaths every year. So isn't it time that we design cities for people and not for cars? So those three sectors alone add up to about 20 million premature deaths. If we were to decarbonize across those three sectors, it's a huge health opportunity. And this is, of course, Ilona Kickbush is here, and one of the first people to call on a health in all policies approach, a One Health approach, planetary health approach. We need to, of course, work across sectors and really take a full systematic view. Our group in Wisconsin has been looking at decarbonization across the United States, what it would mean for health. This is a study we did a couple of years ago, and the headline is that cutting air pollution from fossil fuels could save over 50,000 lives every year and $600 billion in avoided mortality and health and hospitalization and lost work days. So if you look at these results, this is a map of the benefits if we were to decarbonize in our country, the United States. The darker the blue, the better, the more the benefit. And of course, to me, it's not a surprise that the mid-Atlantic region, the Ohio River Valley, is the darkest blue because that's where we have the most coal-fired power plants. And when we look at this map and we think about decarbonizing and where all of these very dirty plants are, there's an equity story here as well, because historically the placement of big power plants, large industries, were disproportionately sited where you had populations of Black, Indigenous, and low-income communities. So a racist past, we need to be aware of this as we move to a just energy transition. Now, Australia has a big problem because you ship a lot of coal around the world. And in fact, when your coal exports are accounted for, Australia goes from being the 15th ranked emitter of CO2 to the 5th. So that's a problem that you need to grapple with. We have plenty of problems in the US, so I won't go there, but this is something that I hope that you can get some traction on. The final sector I want to mention is transportation. And U.S. cities with the highest rates of walking and cycling to work have lower obesity and diabetes rates. And of course, exercise is not just burning calories. Contracting muscles are chemical factories for anti-heart disease and anti-cancer chemicals. And exercise also reduces the risk of dementia and depression. But as we think about building our cities for people, not just for cars, and making them better for active travel, thinking about equity, when we think about this, such infrastructure coupled with community education must extend beyond middle-aged men in lycra, mammals. As Professor Ben Beck, we had lunch together, and Ben Beck pointed this out to me just last week. So we've got to get beyond just the mammals. Mammals, not mammals. Okay. You get it. Also thinking about urban planning and nature-based solutions. These are two maps of Richmond, Virginia. And on the left, you see the red outlined areas are red-lined neighborhoods. And in the 30s and 40s in the United States, if you were black, you were not allowed to buy a house in a nice neighborhood. You had to purchase a house. Even if you had plenty of money, you had to buy a house in a red-zoned area, which meant very undesirable location. And where do you think we invest money for parks and green space? You can see all the green space on the left. It's not in those red-line areas. Look at the map on the right, and that's a temperature map, and that's an urban heat island with a heat wave over a city where you have maybe black asphalt roads, concrete buildings, where you don't have the green space and you have all those heat-retaining surfaces. Those are in the red-zoned areas. This is absolutely not equitable. And I'm about to wrap up here. I have to give you some good news from the Biden administration passing the Inflation Reduction Act, the largest piece of climate legislation in history, $370 billion incentives to reduce greenhouse gas emissions over the next 10 years. And within this big piece of legislation, there's what's called the Justice 40 initiative with the goal of at least 40% of the benefits of new programs flowing into disadvantaged communities. And my final slide, I want to just get to the policy question. We have been looking at trying to bring the health narrative into the UN Conference of the Parties, and through the Global Stocktake initiative, submitting reports like this that point out that there are many policies that already exist. The list there under energy, food, and transportation, those are real-world policies, and we're developing a health and equity criteria so that the policies can be rated for not only reducing greenhouse gas emissions and benefiting climate, stabilizing climate, but do they also benefit health and equity? And ideally, that decision makers that are a little reluctant to moving on climate will see the health rationale as more common ground to move forward and to have policies move faster and further. So this is translating knowledge for policy making. And with that, I want to thank you very much for your attention.
Thank you, Jonathan. Next, we go to Ollie J. One of the big challenges, Ollie, is heat, as you know. What practical and low-carbon, low-cost solutions should we be promoting to protect people and communities, both here and internationally?
Great. Thank you, Brett, and thank you for the opportunity to be part of this esteemed panel. So when I was thinking about the way in which I wanted to address this particular question, I figured that it would be a good idea to separate it into two answers. The first answer will focus on some work that we're doing at the University of Sydney that really focuses on building heat resilience of the most vulnerable people in society. And the solutions that we find must be dependent on the setting and a deep understanding of the setting. The second answer that I'm going to provide is related to something that we can all do to reduce our air conditioning use while maintaining our own heat resilience and not contributing further to the problem down the track. So if we go back to that first question around what the most vulnerable can do during extreme heat events, it's really important that we think about the context. And the context is consisting of both physiological vulnerability or biological vulnerability and the setting in which many of the most vulnerable are finding themselves in. And this is really important because it informs the optimal solution. So I'll just quickly touch on the biological or physiological vulnerability that we see in many of the most vulnerable that crop up in the data that we see in epidemiological literature. We know that advanced aging is a great risk factor for heat-related mortality and morbidity. The reason for this is that there are age-related reductions in the ability to sweat. And when air temperature goes above 35 degrees Celsius, sweating, or the evaporation of sweat, is the only way in which we can physiologically keep cool. But what we also know is that if advanced aging occurs alongside other chronic diseases, particularly cardiovascular disease, this ramps up the risk factors when we're looking at the mortality and morbidity data in heat waves. And the reason for this is that it's the additional strain that extreme heat and humidity imposes on the human body. People with cardiovascular disease find it very difficult to withstand the additional cardiovascular strain that accompanies trying to keep the body cool when we're exposed to hot environments. But it's not just aging, it's not just cardiovascular disease that are risk factors in and of themselves. It's when that is coupled with living in a low resource environment. This is, for example, when people don't have access to air conditioning. They may not have access to a great deal of clean water. Therefore, the type of solutions that we're looking for these types of scenarios shouldn't be simply turn on an air conditioner, because so often people don't have access to air conditioning. In fact, there was an excellent report that was published by the Australian Council of Social Services only a month ago that reported that out of 2,300 heat-vulnerable people, out of those of them that actually had air conditioning, 68% of them choose not to use it on hot days simply because they're concerned about cost of living pressures and the electricity bills that will be coming. So trying to find sustainable, low-resource solutions for these type of settings is really essential. Another thing I'm just going to briefly talk about is the work that we do in the occupational sector. Again, here, context is so vital when we're trying to find solutions. In Bangladesh, for example, people working in the ready-made garment factory industry, which is responsible for more than 80% of exports of the Bangladesh economy, so often they are paid based on output. And what we know from previous research is that when people are exposed to hot conditions, is that they automatically slow down. It's a subconscious thing that we do to protect ourselves. But if you are getting paid on how much you're producing in the workplace, then this means that people have to stay at work for an hour or an hour and a half longer on a hot day than they do on a cooler day. And that speaks to the climate equity or climate justice issues that have been previously mentioned by other speakers. So the type of solutions that we need to find in these particular situations, again, can't rely on high carbon and high cost solutions, but solutions that are scalable and solutions that are fit for that particular environment, and solutions, importantly, that work. So at the University of Sydney, I direct the Heat and Health Research Centre, and nested within the Heat and Health Research Centre is the Thermal Ergonomics Laboratory. And in that laboratory, we have a climate chamber. And in that climate chamber, we can simulate heat waves of the past. We can replicate any ambient temperature that is from the weather records and the accompanying humidity. And then what we do is then recruit human participants under careful clinical supervision, of course, expose them to these simulated heat wave events and measure their physiological responses to these conditions. This also gives us an opportunity to identify the optimal, low-cost, sustainable cooling strategies that will work for reducing the physiological strain, which ultimately leads to heat-related mortality and morbidity. So we can measure which interventions are the most effective at keeping core temperature lower, which interventions are best at mitigating the cardiovascular strain that can prove so deadly for people with cardiovascular disease, and which ones are most effective at not aggravating dehydration, but also reducing dehydration. We also do work looking in the occupational sector as well. So, for example, we've just concluded a study that is focusing on the ready-made garment factory industry in Bangladesh, which is funded by the Wellcome Trust in association with Griffith University. And in this particular study, we simulated the factory conditions. So we kitted out a factory in Dakar with 33 temperature and humidity sensors for a year to measure the temperature and humidity that workers are exposed to. We then recreate those conditions in the chamber, recruit participants, then conduct the same physical activities and work tasks, and then identify which scalable, co-designed strategies can keep people the coolest and also optimize work productivity in that particular case. So we've been conducting this work since 2015, and in 2021 I had the privilege of co-chairing alongside the director of the Monash Sustainable Development Institute, Professor Tony Capon, the first ever Lancet series on heat and health. And in this Lancet series we had an opportunity to summarize the evidence to date that has been driven by physiological evidence which underpins the type of low resource cooling strategies that we should be recommending for people in these low resource settings to ensure that if they don't have air conditioning, that they are actually using the right interventions. We've worked with public health organisations, so health ministries in New South Wales and the state of Victoria, and also we've also partnered with Google recently to ensure that our health recommendations are embedded into a new heat alert app, which is embedded on every Google Chrome app and every Google Maps app worldwide. It gives us an opportunity to get our information literally in the hands of potentially hundreds of millions of people. Through this infographic that we developed with the Lancet as well, we've also had it translated into several different languages to ensure that there's a broader reach beyond just English-speaking countries. So I'll just finish by talking about the second question, or the second answer to the question that Brett asked. And this is, what can we all do to maintain our heat resilience, but at the same time ensure that we're not contributing further to the problem? We know that greenhouse gas emissions associated with air conditioning use, predominantly through the electricity that is used to power air conditioners, which is predominantly from fossil fuel power plants, has got us locked in this vicious cycle. The climate is warming. A lot of people are responding by turning on their air conditioner. That air conditioner is powered by fossil fuel power plants, which belch out more CO2, which then contribute to further warming, which then means more air conditioning use. And this problem is getting worse and worse as we see the uptake of air conditioning worldwide. So over the past few years, we've been pioneering a strategy where we're encouraging people to move air more and chill it less, adopting something called a fan-first cooling strategy. So I'll briefly explain what I mean by this using a simple graph. So many people will be familiar with the idea that over the course of a typical day, ambient temperature will increase. It will stay at a plateau over the course of the afternoon, and when the sun goes down, the air will start to cool. Air conditioning behavior is driven by discomfort, people feeling thermally uncomfortable. And what we know is that there is a temperature threshold above which we feel thermally uncomfortable. It's elicited by thermosensors in our skin. So with typical air conditioning use, what will happen is when air temperature exceeds that temperature limit for discomfort, people will turn on their air conditioner and it will require a certain volume of energy over the course of a particular day. And of course, that area under the curve will be dependent on the peak and the duration of that plateau. But if we take that same set of conditions and we start moving the indoor air a little bit more, and this is very modest. It's at a rate of a speed of 0.8 meters per second, which is the equivalent of a medium setting on a pedestal fan. What this does is that it augments heat loss via a process called convection. And this elevates, this is the important bit, it elevates the temperature at which we will feel thermally uncomfortable. Now, a lot of people have a really hard time accepting this, but if we blinded everyone in this room, and you probably know you got air flowing across your body, but if you just focused on how hot you felt, you would feel the same at 22 degrees Celsius with still air, which is what air conditioning is right now, as you would at 27 degrees Celsius with air blowing across your skin. You'll feel just as cool and you'll feel just as comfortable. And what this means is if we then adjust the thermostat of air conditioning units to a higher set point temperature, where this threshold of thermal discomfort is higher, this means that air conditioners will turn on later in the day, they'll turn off earlier in the day, they won't be working as hard when they're on, and in some days they won't be on at all when, with normal air conditioning behavior, air conditioners will be running for hours. So we wanted to quantify, okay, well, what is the effect of this change in behavior? What's the potential reduction in electricity bills and greenhouse gas emissions? We estimate in an Australian context, if everybody did this in Australia who owns an air conditioner, we would be able to reduce electricity consumption for air chilling, which is one of the leading items on an energy bill throughout the summer, by between 70 to 75%. And we'd have concomitant reductions in greenhouse gas emissions from air conditioning use as well. Now, to put that in context, what does this mean? Well, there's This is a multidisciplinary project, and so I wouldn't pretend that I know exactly what this is, but it's a greenhouse gas abatement cost curve. And effectively, what it tells you is this: the cost of an intervention versus the benefit that we get from the reduction in greenhouse gas emissions. And the really important thing about this is that to date, the best thing that we've been able to do you remember when we changed our lighting about 10 years ago from incandescent lighting to LED lighting? That was a very successful intervention because the greenhouse gas abatement cost was so favorable. And what we estimate is this fan-first cooling strategy is actually superior to that. So with that, I'll finish. Thank you very much.
Well, thank you very much, Ollie. Now we have a chance to hear from Mere Naulu Matua, who's the project team leader, International Group, Hewitt, Fiji. Mere, could you please share your first-hand experience and your knowledge on urban planning interventions for health in the Pacific Islands and provide an example of how governments, researchers and communities can work together?
Okay, good afternoon, everybody. It's nothing like being the last speaker in the last event of the day, but I'll try and keep you interested. Thank you to the organisers for this session, for the opportunity to speak here today about urban planning for health in the Pacific. I've broken up the questions. So first of all, I'll just speak about the planning part. From the time the cholera outbreak in the 1800s, when the reticulated sewer system replaced the practice of the collection of night soil to stop the spread of the disease, to the recent pandemic a few years ago, when those living in urban spaces, urban areas were given specific times to venture out into nearby public open spaces. So whether it's planning to improve human health or human health dictating how we plan our cities, urban planning and health and well-being have always been practiced hand in hand. But somewhere along the lines, as I studied urban planning, I'm a graduate of the last century, 1999, from RMIT, we used to study how somehow health and urban planning went their separate ways, I would think. So my question at the end is for the health practitioners and experts in the room. Is health still being proactive, or has it gone on the wayside? So today I will draw my attention with the projects I'm specifically working on in the Pacific, but really in Fiji it's on the treatment of wastewater and as an intervention to protect and improve human as well as environmental health. I'll also go further and provide examples of how governments, researchers and communities can work together to transfer this knowledge into policy and practice. So just to set the scene, across the Pacific, the 14 Pacific Island countries are increasingly becoming urbanized as we shift from a more traditional healthy rural lifestyle to a more convenient Western one. Urbanization rates in some of these countries are greater than the national population growth rate. So you have countries like Nauru, 100% urban, Fiji, 53% urban, while Tonga and Samoa hovering around 30% urban. But throughout the Pacific, we have relatively small economies. We are very vulnerable environments subject to increasing impacts of climate change, and I don't need to explain all the different impacts that climate change brings along with it over the years. And one thing that I've picked up along the sessions for today and yesterday, which I'd like to pick up on, is that we all have strong and unique indigenous cultures. So the projects that I've worked on are really tapping into also the strong and unique indigenous cultures of the Pacific. How do I do this? Oh gosh. I need help. Next slide. Back. Sorry. this one. Got it? Okay. So I'll go straight to Fiji. We have a population of about 900,000, 53% urbanized, and of that urban population, 20% live in informal settlements. And that's really just attributing to by the influx of people into the urban areas. Now, this RISE project in Fiji, we're working in 12 settlements, plus the demonstration site, 914 households, and 4,289 people. I've worked, here we go again. Uh-oh. Sorry.
This one. Oh, this one.
Yeah. And, okay, without giving too much away, we've got this event coming up next, but I'll clearly just talk very briefly about this RISE project, which is in between the conventional big pipe solutions and the household scale WHS projects, where the big pipes, straight from centralized wastewater treatment, whereas in the household scale WHS, we are asking people with the least resources to manage and treat their own waste. The RISE project has multiple co-benefits across the board, from protection from flood hazards, improving public health, improving environmental quality, stormwater, harvesting and wastewater recycling, and also alternative water supplies and effective use of floodplains. For the RISE project, what we're advocating for is a decentralized wastewater system, and we are going into informal settlements in the urban areas of the Greater Suva area. So what we're doing is we selected 12 sites from the 120 or so sites in the Greater Suva area, and here we are designing clusters of houses where they join to a pressure tank and then to a communal septic tank, where our waste treatment wetlands mimic the natural wetlands. So while the first wetland area will use subsurface plants, and then the second wetland area uses surface plants. So by the time it comes out into the back into the environment, whether it be the river or the soil, it is much cleaner than what has gone in straight, what would have been used earlier, whereas the examples are that raw sewage is going straight back into the environment or into rivers. So to link this to urban planning, what we are seeing is that much of the settlements, much of the environment, the landowners cannot service the demand for residential properties, and it's because of the high cost of infrastructure to connect to a reticulated system to the treatment plant. So that's why they just hold back, because it's just too expensive for people, and that's one of the reasons why informal settlements are mushrooming. But with these decentralized wastewater treatment plant, landowners such as the Intauke Land Trust Board, also the Lands Department, are watching us closely and are actually thinking about incorporating this into their new residential subdivisions, whereby they would set aside a small area and create these decentralized wastewater treatment plants, so that there's no need for it to connect to the city treatment plant. That is really part of urban planning, how we are being proactive in thinking about how to treat waste from residential areas, and how we can increase the density of when you try to accommodate high density populations, that we need to have a reticulated system, and we can't afford to have people using ad hoc septic tank systems because of the high density of people. Now, answering your question on how community consultation perhaps, or how we are moving all this information into policy and strategy, I can't stress enough how this project cannot be successful. It is because of the community participation. We know, I mean, with my Pacific Island friends here in the audience, our culture, we have our, you know, when we're in the community, women will always sit back, not say much. Men will be in the front. Women would rather have their own discussions. Youth will have their own discussions. So it's part of our community consultation, our co-design. We've always had to accommodate for all the different types of groups. Now, this has taken us many years to perfect. And I can say now, after 4 or 5 years, the communities that we work in have total ownership of the RISE project. They know exactly what is being done. They have given consent from step 1 all the way through to where we are now, where we have built the wetlands. They have participated in everything, and they know very well that they can step back if they are not happy with anything, and they are quite vocal in answering questioning the project. You will see the image on the top right, even women making orders on where things should go. The RISE project come in and with a design, put it forward to the community. They may not be happy, so we go back to the drawing board, redesign things, bring it back. Maybe another issue has come up. We decide to put a wetland in someone's cassava patch. We go back, redesign, and it just goes back and forth until everybody is happy. And that is the way that we get good participation from the community, and they have ownership over it. The next slide is other aspects of this RISE project, and this is something that I picked up earlier yesterday, in that data seems to be lacking. We are collecting a whole bunch of data, putting out catching mosquitoes. You can tell I'm not a scientific person, so my words might not relate to that. Catching mosquitoes, we are collecting data samples from water samples, soil samples, boot socks, collecting all this data, and so that we can prove in the end that indeed interventions to reduce the pathway of germs reaching humans will be reduced, and indeed will help improve the health and well-being of people in settlements. We have a very high-class lab, and so those samples come in, we collect the data, we analyze it and store it for future use. And these 4 buddies of mine are very skilled in what they do with all the equipment, and they've the local scientists. And so we have this a lot of data that going forward it can be used to prove whatever interventions that we have used, and it's down to genome level, perhaps. But that's what part of the project is all about. Another aspect which is close to my heart is a coordination committee which we have formed right from day 1 of the project. We needed to get all our stakeholders on board. Now, this is all new to us, this RISE project, not only to the RISE team, but also to our stakeholders, the 4 municipalities, the power company, the water company, and the land agencies. So as we thrashed out the ideas, they'd ask us, why are you going into informal settlements? Well, our answer to that is it is the most difficult group of people that we have to, that anyone would want to provide housing or any type of project in, because these are people who have no rights to the land that they sit on and are always the last ones to get any form of assistance. But we fought, well, we talked and we argued over all our different aspects, and slowly the stakeholders have cottoned on. And so I'm very proud to say in the next, there have been 3 good documents, or at least some progress in how from day 1, I'd say 5 years ago, we were always being questioned about the project. But now I can say that the Department of Town and Country Planning put out a directive to the the municipal councils that they can assess these development applications for waste treatment plants, that what we are doing, and to follow the Public Health Act, because at the end of the day, this is a public health issue, and to make formal decisions at council level. One of the delays that we faced early in the day is that when we lodged our applications with whatever municipal council, it would be passed around to all the agencies here. None of them knew how to assess it. So now there's actually a directive that councils assess it, make the decision at that level using the Public Health Act. Also, the 4 municipal councils and the Department of Town and Country Planning have put out a draft policy guideline on how to assess these RISE applications, not only toward this RISE project stage, but also as applications come when we decide to upscale, or when other big landowners start to create a decentralized wastewater treatment. But the biggest news of all was that 3 weeks ago, the Water Authority of Fiji released their water sector strategy plan for 2050, where it states a new idea is to use a decentralized, nature-based wastewater treatment system, just like the RISE project, for out-of-sequence or unreachable residential subdivisions. Now, I think that's a big win. We've all taken, we've taken lots of years of conversation. Water Authority in talks on for these informal settlements that they will take ownership of the assets after the project has finished. That was another a milestone. But having this in their strategy, and then hopefully, government puts it into their documents as well. And so thus far, this only can be attributed to the mutual respect and trust of the many groups of people that we liaise with, whether it's at the local level or even at government level. So I end my talk there, and I'm happy to take questions if you have any.
Well, thank you so much, Mariette. And it's great to finish with an optimistic note and an uplifting note. And I have to say, as chair of the RISE Governance Committee at Monash Sustainable Development Institute, I'm thrilled about that, because the whole point of a project like this is not just to do some research in one community or a group of communities, but hopefully to scale it up so that can now be the model that is used throughout the Pacific and potentially Southeast Asia. A really positive note. And there is a problem often with these types of conferences where all the news is so bad that people end up not doing anything because it's too hard. And there is a lot of good news, I think, in the climate area. If you look at renewables last year, across the world, there was a 50% increase in renewables additions, mainly actually in China. I mean, we don't hear all that much good news from China. China is leading the way in building renewables. Across Asia, in a number of Asian countries, in India, massive growth in renewables. And I was in Vietnam last week, also major growth in renewables. So it is happening. And here in Australia, we've increased the proportion of renewables in our electricity from about 17% 7 years ago to more than 40% last year. So things are happening, but of course they're not happening fast enough, and they're not happening in all areas. Jonathan talked about transport. I mean, the reality is almost nothing has happened in transport here in Australia. We are miles behind, not just in electric vehicles, but in active transport as well. I think Jonathan also talked about the elephant in the room, which is coal. The reality is that last year, Australia exported something like $150 billion worth of coal and nearly $100 billion of LNG. Now, as a result of that, as Jonathan points out, we're not just sort of 1.5% of the world's emissions. If you add that in, we're up around 3 or 4%. But the positive news, and I'm always a glass half full person, as Ross Garnaut points out, Australia has the power through our incredible access to renewable energy to become a renewable energy superpower. And if we could use that renewable energy to process iron and other metals here instead of it being processed overseas, we could actually reduce global emissions by around 7%. I mean, we can play a huge role. And in a sense, that's a political decision to make, because I think Catherine at the start made such a true statement where she said, these are the choices we make now that will determine how future generations live. We can make these choices in Australia. We can choose to continue to go down the path of coal and gas, or we can shift to a path of renewables, not only for Australia, but for helping the whole world transition to a much safer future. We're now going to have an opportunity for questions, and as I understand, there are microphones that go around. So please put up your hand, and while you're thinking of your questions, I'd just briefly like to reflect on a couple of other points that were made. Renzo, you came up with a number of phrases which I love and I hadn't heard. Glocal. You do have to think globally and locally at the same time. Not only local action to reduce climate change, but also we have to understand that what happens here locally in the emissions that we produce through coal and gas are affecting the globe as well. You also had a phrase which I hadn't heard before called health washing. And that also, like greenwashing, is a huge risk. If all we're seeing is companies just putting a nice green badge on something, but not changing what they do, we're not going to be far ahead. And the other point that you made, which I think is really important, is around mental health and the impact of climate on mental health. And that is an issue potentially here in Australia. We've had the fires, we've had the floods. Some communities have had both. We have a program at Monash, Fire to Flourish, working with some of these communities that have been affected by both fire and flood. And the stress that puts on the community and the stress on mental health is really significant. So I really thank you for that. The final point that you made was made by almost all speakers, which was around climate justice. There is no climate solution without climate justice, as you said. And, maybe that's something, as we're preparing the questions, I might come to you, Renzo, and ask, what for a country like Australia, what should we be thinking about when we think about climate justice? Renzo?
It's on. Okay, good. Wow, I was put on the spot. But I only have one chance to speak to the Australian populace. I think, you already alluded to one part of the solution a while ago, really to stop, coal production and export, transition to renewable energy, but also help other countries establish their renewable energy infrastructure. And then, of course, Australia is doing a lot, for example, in global health, right? With a lot of the global health funding, ODA, so on and so forth. And many countries now really want to establish, as I've mentioned, climate resilient and low carbon health systems. And I think Australia can be an important contributor to that, not only technically, but also financially. So those are my two asks for Australia.
Well, very good. And I didn't warn you either, but you seem to have a prepared answer. That was excellent. Are there questions that are in the audience? Just put up your hand and we'll... there's a question down here. If we can bring a mic. Is there a mic, roving mic?
Yeah. Thank you. Sorry, I've got a question. It's Ben Murray from from Sydney. It's to Jonathan Batts. I wondered if you could maybe reflect on agency given to cities within the US. Often the political stalemate at the national level or even state level just means that there's no progress. Are there lessons that can be learned from city initiatives? And Australia always prides themselves in having Melbourne and Sydney ranked among the most livable cities in the world, but shouldn't we put pressure on those indices to really include a very strong focus on whether cities are livable from a green perspective as well?
Right. And I'll adopt the global mantra. And basically, I think that we really need to look at every solution at every level. There are going to be many places, if the national governments are slow to respond, and even the states, the local initiatives can scale up. And I think it's like the tail wagging the dog. The local initiatives, be it, bikeable communities, and I know a conservative mayor in Texas went full solar, and there's solar panels on the coal mining museum in West Virginia. These are local examples that we can build up, and I think take the opportunities where they come, and I do think that the local could drive bigger changes. And I also think that nationally and internationally, where we saw at COP28 for the first time ever, fossil fuels actually made it into the final agreement. I think you referred to this, Catherine, transitioning away from fossil fuels. It's going to be industry, I think, that recognizes already of fossil fuels being stranded assets, that they're seeing that low carbon means money, there's financial benefit there. So I think it could be that industry, except for the coal and oil and the fossil fuel industry that's picked up the tobacco playbook, except for that industry, I think industry could be leading and governments may follow.
Thanks, Jonathan. Now, I think there was another question.
Yeah, I'm over here. I came up here. This is a question for Ollie, actually. Ollie, where I live, we're still building suburbs with dark roofs. And when I talk to property developers about it, they tell me that's what people want and that's what they're going to keep building. How's there a way we can create signals that actually signal to people buying new homes that they're buying a problem?
Yeah, thanks for that question. Something I didn't really touch on in my talk, given I only had 10 minutes, is that, of course, interventions can be applied not just at the personal level. That's really the kind of last-ditch time that we want to be intervening. There are things that we can do at the building level, and there are things that we can do at the landscape level. And what you're describing is an intervention at the building/landscape level where we're changing the color of surfaces. And so, the effect of that is it can be modeled. And what we know is that if we change, so for example, if I use the work that we've done in the Bangladesh ready-made garment factory industry, we looked at applying a insulative reflective roof on the factory, and we modeled it. And it created around about a 2.5 to 3 degrees Celsius reduction in internal temperatures. Now, the question, of course, is then, what does that mean in terms of the impact on the people? And so what we really need to be doing is thinking about doing human-centered modeling. And I think that's the challenge at the moment. A lot of the advocacy talks about reductions in temperature, but those reductions in temperature are not contextualized in terms of what it means for human health and well-being in terms of their experience, so thermal comfort, thermal sensation, but also what it does to the body as well. And it may very well be is that a 3 degrees Celsius reduction on the hottest parts of the year is not enough, and we need to do more. But in response to your question, I think providing more human-centered, impact-based data on how these interventions will actually play out is really where it will matter.
Thank you. Other questions?
Yes. May I ask one?
Yes.
Okay. Thank you very much to the panel for a fantastic discussion. I want to give two disclaimers. First, I'm not a climate expert, so whatever I'll ask, it will be from a citizen, like responsible citizen. And the second one is to Dr. Ali. In Bangladesh, we are using, I think, electric and table fans since decades, but still we are the worst victims of climate change. I think, yeah, one of the 6. I know you know the reason behind that. The first question is directed to Renzo. Renzo, at one point you said medical doctors should have knowledge on climate change and definitely expertise to deal with impact of climate change on health. What do you think? Like, I'm wondering, are you thinking of a course or a medical curriculum should be amended to include planetary health or climate change to that? Yeah, and I'm thinking, yeah, great. The answer is in front of me. And the second question, which is very interesting because right now we are facing the worst heat wave in Bangladesh. And in a couple of weeks, I think after 6 or 8 weeks, we'll face rain and then flood and we'll get blamed. The general public will get blamed. Oh, you guys are doing it. You are not using polythene properly, clogging of drainage, and everything is happening because of the general public's irresponsible behavior. Our government officials will give statements like that, and we'll hear a lot of commitments from the government and no action at all. We'll attend panel discussions as well on climate change. But at the end, we'll see no action from the government. So I want to hear from you. Do you have any suggestion to mobilize the government so that they can give some action, show some action without giving commitments to the public?
So I'll answer first, and thanks, Tasdik, for that question. And I'll also give a chance to Jonathan to do a show and tell. He has a visual aid with him. And, you know, it's interesting. Just yesterday, the Planetary Health Report Card launched its 2024 report, and it did rankings of medical schools and other health professional schools from around the world as to which schools are actually starting to incorporate planetary health, climate and health into the curriculum. And I think my quick answer is it's a huge space for creativity and innovation. It depends on the context. In the Philippines, we've been trying to develop additional courses, modules on climate and health. In fact, the students themselves are initiating educational opportunities when medical schools and deans are slow to respond, you know, to the growing demand among young people. But, you know, in other for example, medical care, healthcare systems, different specialties can be more creative. How do you teach, you know, I just got a request from the Singapore General Hospital, can you teach climate and health to pathologists? And even pathologists who are working inside the laboratory do have a role to play in climate action. So again, you know, I would love to see more innovative models on how we can incorporate climate and health. But also lastly, it's not just about adding more content. It's really rethinking health workforce, you know, planning. You know, I'm finishing a paper now with several Australian colleagues on how can we address brain drain as we expect more of that to happen in an era of a warming planet. So thinking broadly beyond the curriculum.
Very, very quick comment. Great answer. And just with the very crowded curriculum, the key thing is to recognize that climate change is not an add-on. As Catherine and Renzo talked about, the multiple pathways through which climate affects our health, everything that's in the curriculum already can be exacerbated. So I put it there. And of course, you know, you want to keep things brief. This is the most condensed, very wonderful second edition, just released this week, actually last month, Climate Change and Public Health by Barry Levy and myself.
Do we get free copies like Oprah?
Well,
what Oprah does.
Thank you to our sponsors. I think we've got time for one last question. Was there one there?
Thank you. Colin Bell from Deakin University, and a question for Mehdi. Thank you for that really interesting presentation. I was struck by the inequity associated with the big pipes, as you call them, or the reticulated system. And I wondered if you could comment on whether part of the solution to that is actually the decentralized systems that you're introducing into the informal sediments.
Ready to speak? Okay. Thanks for that question. Yes. Well, the example that I have in Fiji, I don't have a map of it, but the entire peninsula, the Greater Suva area, that's 4 municipalities, only have the one treatment plant, and it doesn't make sense and there's a lot of land to create residential subdivisions, but they can't develop that land or create subdivisions because of the cost to pipe the wastewater to the main treatment plant. So the short answer is yes, it is a solution for new development to have decentralized wastewater systems. Now, it could be a combination of, like some of our settlements, as the conversations have gone on, instead of having their own decentralized, the Water Authority have said, you do your good work, but then you can connect to our line, things like that. So slowly the thinking is there that as long as we can somehow connect all the houses within that residential subdivision and then connect to the main lines, that's one way. Another one is seriously having your own decentralized nature-based system in isolation. And that works fine.
Well, thank you, Mary. We are out of time. We could be going on for another half an hour. I'm sure there's lots of questions, but people will be able to talk out of the session. Can I just thank all of the panellists for what's been a really, really interesting session. Thank you.
And my thanks again to Catherine, Renzo, Jonathan, Ollie and Mette. And a huge thank you to all of you who've come. Very quickly, I just want to invite Karen Leader up here because there is another satellite session about to commence on Rise that you've had a sneak peek at from Mette. So thanks again. Go forward with actions. We've been inspired by all our speakers today, and thanks so much for coming.